We're really excited today to bring you the program. You've heard so much about the Health Care Act and the Affordable Care Act, as ACA, as you may see it abbreviated. And there's so many knowns and unknowns about this and the way it's going to impact us. So we're here today to talk about the impact and the implementation of the Affordable Care Act in New York State. It will vary a little bit from state to state, but there are many provisions of this act that are really of benefit to us, and there are some parts that people just aren't certain about. So we're hoping that by Gail Myers being here today, we'll bring you a little bit more to enlighten you on the background of the act and how it's going to impact us here in New York. Gail Myers I have known for many years. Gail has been very active in the legislative and political realm of healthcare. She has worked with the Medical Society of the State of New York. She's worked with the New York State Nurses Association, and she's also worked under Governor Spitzer with the Commissioner on Aging, and now she is coordinating and program specialist for the New York State Senior Action Network. So it's a great pleasure that I introduce Gail Myers, who has a wealth of knowledge and experience, and we're tapping into her, and she put together a program for us. On your table, you have her presentation so that you can follow through as she's speaking through and going through the slides. So we'll have Gail speak first, and then we're going to have Dr. Cousin and introduce him when he's ready to present too. So we hope that you will take in all the information, and we'll leave time for questions also. Thank you.
Okay. Thank you, Carol, and thank you, League of Women Voters. So I do have a slide PowerPoint presentation for you today. What I'm going to show you is somewhat different than what you have in front of you. And I hope that that's okay with you, and you'll see why. I've got some political cartoons that I want to show, and that will be the picture that you're able to take away with to be able to say, what is this all about and what's going on? What I wanted to do was to give you the slide packet of all of the data, the facts, the figures, the things that you might hear and say, I want to take a note on that. If I thought I might hear it and take a note on it, I gave it to you in that slide presentation. So, hi, and I want to say to both of the high schoolers that are here, this is, sort of, if I cannot have this within my designated 15 minutes, my first trip to the Capitol. I'm a Long Islander. I don't know if anybody noticed the accent or not, but my first trip to the Capitol was with the 4-H club when I was in 8th grade. And I wasn't a member of the 4-H club, but I heard they were going to the Capitol, so I went. It's Long Island, we didn't have much to do with 4-H. But I volunteered, and I said I wanted to be on that trip, and I walked into that building, and I said, someday I'm going to work here, because it was so awesome. And everybody laughed at me because, what did I know at the time? I was in junior high. That's what we used to call middle school. And then by the time I wound up in college, I was working in the same building with those magnificent history and architecture. So it's fun. Keep going. Keep going. I want to tell you a little bit about my organization. And it should be interesting for you to note that we work very closely with the League in Albany. We have very similar policy points of view. The organization I represent is the New York Statewide Senior Action Council. We do lots of different things, but we do have a legislative agenda. We do have a toll-free phone number for people to call if they have questions about Medicare or patients' rights, or basically anything. We can be your one place to start if you have a question on health policy or consumer advocacy. We do have chapters throughout the state, and we are looking forward to forming a chapter here. Our priority issues are dealing with economic security and health security, and we see those two things going hand in hand. Some people say to me, are you AARP? And I say, no, they're AARP, and AARP is a great organization, but we are different in a couple of ways. One is that we are a grassroots organization. Our policy decisions do not come from Washington And they don't come from my office in Albany. They come from our annual convention where our members get together and decide what should be our focus for the next year. And then local chapters, like this is your local chapter, work on issues that are compatible with health and fiscal and economic security. But just to give you an example, our Western New York, our Buffalo chapter is working on foreclosure prevention. They're bringing information to neighborhoods and helping people to avoid foreclosure and to avoid financial scams. Our Central New York, this area down, and the Catskills are working against fracking. You've probably heard a little bit about fracking from time to time. Our North Country chapter is working on aging in place, how to make sure that there are enough choices in healthcare facilities and community-based care for people living in rural communities to be able to age in the community. Our New York City chapter is working on a lot of things, but predominantly right now they're working to stop hunger for all ages. And our Capital District chapter is working on single-payer New York, the New York health legislation that will be a universal single-payer replacement for the Affordable Care Act in New York State. So that is a little bit about us, and I hope that you will consider joining us. So here's something you don't have in your slide deck. Remember Harry and Louise? Anybody remember Harry and Louise? Am I the only one? Okay, good. So way back during the Clinton administration, Hillary Clinton was tasked with what she probably thought was her biggest challenge, not realizing she was going to become Secretary of State, to develop a healthcare system. And the industry, by and large, revolted at the idea. There were a lot of criticisms, both of the process and the outcome. And what she was thinking about was letting insurance companies continue to be having a great marketplace that would be regulated. And we had these Harry and Louise commercials where they sat at their kitchen table and said, "Oh, woe is us. Who will ever let us go to our doctor? We will have to have socialized medicine." Well, that was then. Now we have Harry has dearly departed, and he lost his health insurance due to a pre-existing condition in 2005. And Louise, in 2007, went bankrupt trying to pay Harry's medical bills. So we look at what was going on so many years ago and saying there was something new that needed to come along the pike and fix some of these situations. Health bankruptcy is one of the major reasons that seniors don't have the income they need to live and to live well in the community. So I give you this slide. I'm not going to talk about it, but the out-of-pocket expenses for Medicare are large. Many people think, my own children, that while Medicare is a universal coverage program, which is good, we talk about expanding Medicare for all, that Medicare is free. It is not free. It is an earned benefit for hospitalization and a paid benefit for physician services, medical services, and drugs, and a whole range of other things. So you've got some information on that. Now, what's happening in Congress is that you read the newspapers every day, you're league members, you're informed, you know what's going on. But there has been an overall disconnect between what really should be done and the reality of what can be done. But one thing that was pretty clear throughout the last 4 or 5 years, the last 2 presidential elections, besides the strife, of course, was that people were saying to seniors are a tremendously strong voting bloc. Everybody talks about the senior vote. The seniors, greatest generation, the baby boomer generation, are strong voters. And so in order to make changes in Medicare and Social Security and in the Affordable Care Act and other types of programs, Congress often says, don't worry, it's not going to affect you if you are older than 55. So here's Congress members going up the hill, and it says, if you're 55 or older, your Medicare vote won't affect you. Well, I'm very proud of our membership because our membership doesn't care. They don't sit back and say, that's great that none of this is going to hurt us. And we'll talk a little bit more as you see the presentation about some of it does certainly impact Medicare. They want Medicare for future generations. They want Medicare for all. It's not okay to buy off the current senior voters by saying this is not going to impact you. because if it weren't for the senior voters in the 60s, we wouldn't have had Medicaid and Medicare to begin with. And if it weren't for the seniors in the 70s and the 80s and the 90s, we wouldn't have half the programs that we have in the Older Americans Act. So it's for the future, and we like to pass it on, and I hope you'll remember that message. When somebody says to you, oh, don't worry, it's not going to affect you if you're older than 55, you say, yes, but it will affect my children and my neighbors and my grandchildren and my great-great-great-grandchildren. So let's preserve it. All right, the Affordable Care Act. These are all these names. It started out as PPACA. As Carol said, we're going to call it the ACA, or the Affordable Care Act, for today. One of the things that I want to make sure is that you have the fundamentals of what is in there and what is not. It was adopted in 2010. There was a lot of newspaper coverage during 2010. So then I was reading a lot of articles, what's in it, what's not in it. And that was so long ago now. Well, the reality is that most of it has already been implemented. Is that a surprise to you? Because people talk about implementing it now or delaying its implementation. So many of the benefits, so many of the policies have already been implemented. What's left to do is to create the health insurance exchange, where uninsured New Yorkers will be able to buy health insurance sort of at this grand shopping plaza on a computer, and we'll get into that a little bit more. But that's the last and the most well-known part of the ACA to be adopted. We have had tremendous bipartisan battles, and one of the things about these debates, and I reflected upon it about what's in the name of Obamacare, is that in the beginning, those opposed to the Affordable Care Act called it Obamacare. This was the way to defeat the president, to say he's responsible for it. But they also said the president is sitting in the White House and he's not getting involved in the debate. So how do you blame somebody for authoring something when you're also blaming them for not coming to the party? Well, as we moved into last year's the re-election for the president, he embraced it. He said, I am pleased to have this named after me in the news media cycles of it, because he saw that it was working, and he also saw that they were able to maintain some of their political presence in the Capitol. But what happened, and you saw it around here too, the House of Representatives changed hands, by and large, over this issue. It is all about politics, folks, right? All of this stuff always is. But the far left also was as unhappy with the Affordable Care Act as those that didn't want to see a mandate or didn't want to see any change in tremendously escalating health care costs. And that's when the president said, no single-payer option, no more public option. This is not Medicare for all. We're going to let the insurance companies continue to sell insurance. And the president and Congress, when they negotiated, they were able to do something quite amazing. By and large, the medical community and the hospital community also said, we have some concerns and some platforms that we want you to include, but there was no outrageous, you got to stop this. Not until after it passed. Because when you think about it, it enshrines insurance companies. By saying that you're going to take 50 million people in the United States and make sure that they have insurance, that means that insurance companies are selling insurance. That means that pharmaceutical providers are selling drugs. They're making money. There are some pieces of it that limit the amount of money they can make. But by and large, they've just gotten this gift from the government that says, we have a product for sale, right? So everything has a little piece of this action, and it's only after it was passed, the deal sort of fell off with the White House because politics got re-involved again, and people started protesting the implementation. So we have healthcare reform, and I'm going to really talk to you now about the components of what's in there. So really kudos to the League. This is why. Kaiser Health, they do a lot of public information polling, and here's what they know. 6 out of 10 Americans say they don't have enough information about the Affordable Care Act to know how it will affect them themselves. So that's pretty awful. When you people about what they feel about the Affordable Care Act, it leans slightly negative. 40% say they have an unfavorable view. Now remember, 6 out of 10 said they don't know what's in it or how it's going to affect them, but they have an unfavorable view, and about 35% say it has a favorable view. But what happens when people start learning about what's in it? You at least can say, this is who it's going to impact, and this is who it's not going to impact. It will not impact, by and large, anyone who currently has insurance. You get to keep your current insurance, doesn't do anything. What it does say is that insurers have a responsibility to change the way they do business so that if you are insured, right before the Affordable Care Act, your insurance company could have decided they're going to drop you. They could have decided on a financial limit of how much they're going to pay for your care that you've been paying for in premiums. There's a huge range of reforms, and I have them listed in your packet, that are improved for all of us who have insurance, and the people who don't have insurance are going to be helped to afford it by being able to purchase it through the marketplace. And yeah, there's going to be some people, basically more than mid-90,000 income a year with family of 4, who are going to have to pay a little bit more out of pocket and will not have a subsidy if they don't have insurance already. But the reality of insurance, and you all know this, is that those who have been insured have been paying for the uninsured all along. When you go to a hospital and you don't get turned away because you don't have insurance, somebody's paying that bill, and that's the rest of us, taxpayers and insurers. There's a very, very great YouTube video. If you just type in Nurses Explain the Health Care Act in 90 seconds, 90 seconds will be everything you need to know, except for what I'm going to tell you about the Affordable Care Act. I think that there are some predominant areas that you can think about. Coverage expansion is what we're all talking about. What is the exchange? Who is going to does not have insurance? That's coverage expansions. It includes an expansion of Medicaid to 135% of the federal poverty level. And it also allows Medicaid to cover single adults. Used to be, if you didn't have a kid, you didn't get health insurance. Access to care is improved, and I'm sure we'll hear a little bit more about the changes in both access to care with physician supports and nurse supports, as well as some of the quality issues. There are both quality and cost reforms in the quality piece, and then there are insurance reforms that will provide you with very tangible benefits. So already a benefit in place, implemented, has been the prohibition on saying children won't be covered if they have a pre-existing condition. And you all may remember the media coverage when a family who had insurance went to the hospital with insurance, and when their baby was born, multiple disabilities. The insurer said, yes, you were insured while you were in the womb, but once you came out, we're not covering you anymore because you have a pre-existing condition, a birth defect. There are horrible stories like that. So that is already in place for kids, and in 2014, it's going to be in place for all of the rest of us. If, as a woman, I have breast cancer that has been treated and cared for through my health insurance, and I have my health insurance through my job. Right now, if I leave jobs and go to another health insurance plan, they can say, sorry, you're a risk, we're not covering you. So people wind up staying tied to jobs that are not good for them because they know that at least their existing condition happened during that health insurance, so they don't have to sacrifice that. So there are a number of reforms, and I have written those down for you. Again, I'm not going to go through this. You have the detail on the Medicaid expansion, who's covered, what it is. I've given you the amount of money. What does that really mean? When you say Medicaid expands to 133% of poverty, how many of us walk around with those numbers in our head? So those are the numbers. This chart, which is very hard to read up here, but you have in there, shows you the number of uninsured. One of the failings, and there are many, in the Affordable Care Act is that it does not provide universal coverage for everyone. In New York, it's going to be able to hit about half of the uninsured New Yorkers. Medicare. So I usually do a presentation of 2 hours long, and it's only for senior citizens. We spend a lot of time talking about Medicare, but Medicare implementation in the Affordable Care Act has been going on for several years. Since 2002, there's been effort to close the donut hole in Medicare. That is the gap in insurance coverage for drugs. And if you were in the donut hole where you didn't have any insurance coverage for Medicare, you got a $250 thank you check from the government as the first implementation for closing the donut hole. Since then, there have been changes so that in the donut hole, you would only have to pay about 50% for name brand drugs, discounted so through 2020. The donut hole will close and you will only be paying the regular co-payments that you would pay either before the donut hole or afterwards. So that was a major accomplishment. Another accomplishment in the Affordable Care Act that seniors particularly care about is that the Medicare Trust Fund solvency was extended. We hear from Washington all about, there's a war on the budget. There needs to be cuts in Medicare. There needs to be cuts in Social Security. Well, in the Affordable Care Act, changes were made in reimbursement methodologies, and lower reimbursements went to health insurers that were making excessive profits to be able to reinvest that money back into Medicare to keep it alive and well until 2024. The health exchange. All right, so you're going to picture a supermarket in the sky up there in the cloud. You go to a computer. If you don't have one, you can go to a navigator, someone who is going to be paid through this act to help you through. And this is for you if you do not have insurance. So there are most people who are going to be using the exchange are people who currently do not have insurance. It is going to automatically allow you to enroll in Medicaid if your numbers are below 135 of the poverty. It's going to automatically give you a premium subsidy that will go straight to the insurance company and discount the amount of money that you have. That was the part that was from the tax department. It was, sort of called a tax credit. Instead of getting it when you file, paying your insurance premium, and then next April, paying your insurance premium starting in 2014, and then in 2015, filing your taxes and getting a credit. This is an automatic credit. You will see it on the screen. It will tell you how much you're entitled to. That's your subsidy. That will go straight to pay your insurance premiums, and if there's anything difference, then that's the amount that you would pay. I've given you the penalties. The penalties are low in 2014 and will start to get higher by 2016 so that people can gradually get the idea of this. They're going to gradually get the idea that it is better to pay for health insurance than it is to pay a penalty to not have it. Think about this. Family of 4 with income less than $94,200 are going to have assistance in the marketplace to get the premium relief that they need. The health exchange will start to be in effect October 1st. To go online or have a navigator help you buy insurance, you need to know the definitions. And the program will help you through. But it is always better to know these things ahead of time. And that's some of the things that you all can help people with. People don't understand what's a deductible, what's a copayment, how much they want to insure for. Do they want to have an insurance plan that covers everything and they will never pay anything out of pocket? Or do they want an insurance plan that's more affordable every month and that they will pay for co-payments when they need to use care? So there's lots of things in the terminology that people don't understand, and I don't understand it all when I see my monthly statements from the insurance company, and I'm in this business. I look at it and say, I have no idea what they're talking about. I sometimes say, am I supposed to pay this or did they pay this? So that's the kind of awareness you need to have before you shop on the exchange. But thinking about this Affordable Care Act, legislators made this deal about the Affordable Care Act. They didn't just make it about insurance coverage. They made it about improvements in public health and innovations in medicine. They added a lot of other things to improve and reform healthcare. And you have the list. It is improving surveillance in nursing homes. It is helping to end elder abuse. There are a large number of amazing programs that are included in this. And the insurance forms. Your kids up to the age of 26 can be on your insurance. My son works in New York City. He's 24 years old. He's on my family coverage. I don't have to pay any more for him. Right? That's part of the coverage for young adults. Doesn't matter if they're in college, doesn't matter if they are working, doesn't matter if they can buy their own health insurance. Ends discrimination based on pre-existing conditions and gender. So this says no, there has to be an equality across the premium setting. And a huge range of issues that are really important if you think about it. Your insurance just can't go away when you need it. No lifetime cap, no end of a policy because they don't want to insure you anymore. So that is reform. I don't want you to think about it as insurance coverage for the uninsured. I want you to think about it as truly, what would you think if you were reforming the healthcare delivery system? Most of my members say, get rid of this whole thing and give us single payer, and that reforms everything. Of Obamacare, we're going to see a lot in the media in the next several months about how terrible it is and how people shouldn't be forced to buy health care. But in fact, he says the beginning is near, because so much of this law has been implemented already that repealing it is quite ridiculous. Creating something new, maybe, but repealing it is quite ridiculous. This great state that we live in, where you all have been advocating for years for things like mammography should be a covered health insurance mandate, maternity care should be a covered health insurance mandate, mental health parity should exist. So many of the reforms that we've done in New York State over the last 10, 15 years are included, that we are not going to see escalating premium costs here. You can say I said that, because a lot of the researchers are absolutely saying that. New York, in fact, it looks like the premium costs will go down here because things will be leveling off. So I'd like you to be my friend. This is our Facebook page. It's in your slide deck in case you have Facebook. I do a lot of policy, wonkish stuff on there, but also some fun things too. And our webpage and my contact information. And that is the end of your day. You can all go home now because I'm sorry it took so long.
So my question is, since we have a monopoly in the area right now, what will happen when health reform goes into effect and they have this health insurance exchange?
The expectation is that the costs are going to be much more affordable for you. Why? Because there's a limit on how much out of pocket, based on your income, that you're going to wind up having to spend for your health insurance. The state is going to be setting the rates in the exchange. They're going to be picking the insurance products that go into the store, the supermarket, and they're going to come up with a determination of what is affordable, and a lot of the slides showed you income levels, right? Right now, it is almost not affordable to buy health insurance on your own, even if you're healthy. When I was doing a COBRA plan for my family in between jobs, it was $1,200 a month. I said, I'm taking almost my entire unemployment check and buying my health insurance. This is not affordable. So the expectation is it will be affordable. It will not be allowed to be more than 9% of your income, and there are going to be subsidies for families and for individuals well below 400% of the federal poverty level to make sure that if the insurance premium cost is high, that they have a tax break that goes right into the system to maybe cut it in half or 3/4. Stay tuned. The state is working on the implementation. They are lining up insurers. The expectation is that there will be choice and there will be competitive plans. There's 4 levels of plans to choose from at different levels prices.